In this video, we'll be going through how to get into medical school and giving you some tips and things to consider before an application to medical school. It seems really obvious, but the first thing to do is to really make sure that medicine is the right choice for you in terms of a career. It's a really long road ahead, and if you make the wrong decision now, then you may end up regretting it for a long time. Medical school is between 5 and 6 years, and then there's at least another 10 years of training to become a consultant if you're going into hospital medicine, or another 5 years if you want to become a GP. So that's between 15 and 20 years of training, and so if you're not in the right job, it can be really difficult. There's going to be lots of sleepless nights, not just with studying, but then when you become a doctor, there'll be lots of night shifts, and more, even consultants are being expected to come in overnight if you work in a hospital specialty. So you must be prepared to be able to spend a long period of time in your place of work, whether that's hospital or GP practice, and to be doing night shifts probably to the end of your career. And as I alluded to, there's going to be lots of studying, not just during medical school, not just getting into medical school, but throughout the whole of your career. You're constantly going to be learning, constantly going to be reading papers and updating your practice. So make sure you're comfortable with a lifetime of learning and trying to keep yourself up to date with the latest developments. Make sure you have the right qualifications. There are lots of different places where you can look to see what is needed. The UCAS website is really great for some generic information with regards to what is required and what universities require which things. Now, in terms of A-levels, GCSEs and international baccalaureates and so on, it's really important to look at the individual websites as well, because the criteria are slightly different and they change every year as well. So always look at the website for the most up-to-date information and make sure that you hit each of those points. Each university gets so many applications that if you haven't got those points, we just will ignore you and go on to the next one. So make sure you get everything that's needed beforehand. Work experience is really important. There are lots of different ways of getting work experience. The traditional way was to come to hospital and to go and watch surgery or go onto the wards and see how the medical doctors deal with patients. However, there are many other opportunities available, and so don't be bogged down by that. And especially if it's difficult to organise work experience, think around the box a little bit. You can go to GP surgeries, and they're usually really helpful and probably sometimes a bit easier to organise than a hospital. You can talk to physiotherapists or go to a rehab unit, which again often is easier to get a place to come and do some work experience, but will highlight all the important things that you need to see in order to know whether you want to become a doctor, and to give you the stories that are useful to talk about in both your personal statement and your interview. And the other thing that people sometimes forget is lab-based research is really useful as well, especially if you're interested in research, because it gives you another dimension and something additional and extra that you can talk about in both the interview and the personal statement. In addition to work experience, volunteering is really important, and you can use the two together. And you could volunteer in a hospital and therefore use it as part work experience, but also to try and show that you're a caring person. Because everyone who applies to medical school will be academically able. What you need to highlight is the other aspect of being a doctor, which is being caring, and volunteering is a great way to do that. There are lots of different ways of volunteering. You could volunteer with elderly patients, say for a charity like Age Concern, or at your local elderly care home. You can go to a hospice and help there, and you can give a fantastic amount of help to people in the latter part of their life, and also get a real idea of patient interactions, how to give people dignity, and making sure that people feel safe and comfortable. It can be difficult to get these volunteering posts in hospices, so it's really worth speaking early and going and speaking to them in person to show them what type of person you are. Working with children and disabled kids, a really useful way of just improving your non-verbal communication skills, as well as showing that you care about a breadth of different types of people. You can do marathons and other ways of fundraising, which often look really good on an application, where people talk about the X amount of money that they raised for a particular charity that's close to them. Not only does that show your volunteering side, but it also shows your extracurricular activities, like, for example, running marathons, training, that sort of thing. and then helping volunteer train children in local areas. For example, helping with coaching a children's football team. Not only does that show that you're volunteering your time, that you care about kids, but also that you've got the organisational skills and the skill set to be able to coach and teach people. And finally, homeless people, especially in this day and age, there's so many homeless people around that there are plenty of opportunities to work with them, both in terms of shelters, soup kitchens, and just fundraising. So again, something really worth thinking about. And especially if you've not been able to get work experience, these are great opportunities to still show that you can help people and that you've got that caring side to you. Personal statement's really important. It's what gets your foot in the door. And so really do think about it and get a really good high quality personal statement. Exams are going to be really important in applications, and many of the UK medical schools now have entrance exams by way of either the BMAT or the UCAT. Have a look at the websites. Keep an eye on our YouTube channel because we'll be giving lots of different example questions and how to answer them. But really start practicing early. I normally suggest starting at least 6 months, but probably a year beforehand, and doing all the practice questions you can get your hands on and talking to people about why the answers are the way that they are and what particularly we're looking for in the BMAT answers. Interview is a lot of the application process, and it's really the be all and end all. Once you've got your foot in the door with the personal statement and with your UCAS application, we purely base things on the interview. So get lots of practice. We're going to have lots of different things on our YouTube channel talking about what we're looking for in the interview and how best to answer some of those questions. There's going to be loads of videos looking at how to get into medical school and different tips and tricks on how you can shine at an interview or in your personal statement. Check out the rest of our YouTube channel, which has got plenty of these videos, and we'll have more as time goes on.